The labs tested for the wrong strain. The results came back negative. Weeks were lost. Now an American doctor is on his way to Germany. 500 people are suspected infected. 131 are dead. And the WHO declared an Ebola emergency before a single committee meeting was held. That has never happened before. An American doctor is on his way to Germany for treatment. More than 500 people are suspected of being infected. At least 131 are dead. And the world, for the first time in its history, is dealing with an Ebola emergency declared before a single committee meeting was even convened. The outbreak of the Bundibugyo strain of Ebola in the Democratic Republic of Congo has been spreading since at least late April, most of it undetected. The first death was recorded on April 24th in Bunia, the capital of the eastern Ituri province. When samples were sent for testing, labs looked for the wrong strain. They came back negative. Weeks were lost.
First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area.
By the time the WHO was alerted to around 50 deaths in Mongwalu on May 5th, the virus had already moved. Cases have since been confirmed in Goma, Butembo, Nyankunde, and across the border in Uganda. The first case was only officially confirmed on May 14th.
I would say that our concern about this outbreak is pretty high. This is Bundibugyo, which is a Ebola strain that we have only a couple of outbreaks have occurred historically, so we have less experience with this strain, but I think we are concerned that it will behave like the Ebola that we know well. It's occurring in an environment that proved really, really challenging in 2018, 2019, when we had a vaccine already ready and were able to deploy that.
The American doctor, identified as Peter Stafford, had been treating patients at Nyankunde Hospital in Bunia since 2023, when he developed symptoms. His wife, Dr. Rebecca Stafford, was also exposed but is not showing symptoms. The couple have 4 young children. 6 other Americans have also been exposed and are being moved out of the country.
So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States.
Ituri province, where most cases have been reported, is in the middle of an armed conflict. Over 100,000 people have been newly displaced since late 2025. In an Ebola outbreak, displacement does not just complicate the response, it accelerates everything. US health officials are reportedly monitoring a growing Ebola outbreak in Central Africa, while dozens of Americans are also being observed following a separate Hantavirus exposure linked to an Antarctic cruise ship. According to a report by Newsweek, the US Centers for Disease Control and Prevention said a small number of Americans are being withdrawn from the Democratic Republic of the Congo and Uganda after possible exposure to Ebola cases, following the World Health Organization's declaration of a public health emergency of international concern.
We are assisting those directly affected by the outbreak following the World Health Organization's declaration of a public health emergency of international concern. The outbreak has so far included 10 confirmed cases and 336 suspected cases, 88 of them fatal, in the DRC, along with 2 confirmed cases and 1 death in Uganda.
According to the CDC, the risk to the American public remains low, but officials warn the outbreak remains highly concerning because of Ebola's severe fatality rate and ability to spread rapidly between humans.
While the risk to the American public remains low, the outbreak is of notable concern given that associated death rates range from 25 to 50%.
The warning comes weeks after a Hantavirus outbreak aboard the Antarctic expedition cruise ship MV Hantavirus left 41 people across the United States under monitoring after possible exposure either directly on board or indirectly after travel. According to the World Health Organization, both Ebola and Hantavirus are considered highly dangerous diseases with elevated fatality rates. Data shows Hantavirus cardiopulmonary syndrome carries a fatality rate of up to 50%, while Ebola outbreaks historically have ranged from 25 to 90%, depending on the strain and access to treatment. However, health experts cited by Newsweek said Ebola is viewed as the greater immediate concern because it spreads more easily through human-to-human contact and has a long history of rapidly escalating outbreaks in vulnerable regions.
Ebola can spread between people from direct contact with the blood or body fluids of a person who is sick with or has died from Ebola disease, or from surfaces contaminated with those infected fluids.
Hantavirus, meanwhile, is typically contracted through exposure to infected rodents, including their urine, saliva, or droppings. Human-to-human transmission of Hantavirus remains extremely rare. The two diseases also differ in symptom timelines. According to health authorities, Ebola and Hantavirus belong to different virus families. Hantavirus is part of the Bunyavirales family, while Ebola belongs to Mononegavirales. Symptom onset also differs significantly. Hantavirus symptoms can appear 1 to 8 weeks after exposure, while Ebola symptoms typically develop within 2 to 21 days. Hantavirus symptoms include fever, headache, muscle aches, nausea, vomiting, and abdominal pain. Ebola symptoms include fever, fatigue, sore throat, vomiting, diarrhea, rash, and kidney or liver complications. Transmission patterns are also different. Hantavirus generally does not spread from person to person, while person-to-person transmission is common in Ebola. The two viruses also affect different organs. Hantavirus primarily targets the lungs and kidneys, while Ebola impacts the liver, vascular system, and multiple organs. Their animal reservoirs differ as well, rodents for Hantavirus and fruit bats for Ebola. Case fatality rates vary widely. Hantavirus pulmonary syndrome has a fatality rate of around 38%, while HFRS ranges from 1 to 15%. Ebola fatality rates can range from 25 to 90%, depending on the outbreak and strain. When it comes to vaccines, no approved vaccine is currently available for Hantavirus. While Ebola has approved vaccines including Ervebo and Zabdenomvabia. The biggest practical distinction is transmissibility. Ebola spreads between people and fast. Hantavirus, in most cases, is a dead-end infection picked up from rodents, not passed on. That's what makes the current Ebola outbreak the one keeping health officials up at night. 10 confirmed cases, over 300 suspected, 88 deaths, and counting. The CDC says it is continuing to assist affected Americans and monitoring both outbreaks closely. But with Ebola now declared a public health emergency of international concern, the window between low risk and global threat is narrower than it looks. 2 outbreaks, 2 viruses. And for the Americans caught in the middle, the waiting has already begun.